Hi, everyone. Welcome to our webinar with the TeleDentist. Thank you for joining us today. My name is Carrie Hamilton. I am the Chief Marketing Officer for Nobility, which is the parent company of Elevate Billing Solutions, our dental division. I also serve as manager of that division. And we have been noticing with a number of our clients and just in the industry in general, we're seeing a lot of changes due to the economy. We're seeing patient volumes reduce. We're hearing from our clients that they're seeing production is down. And so what we wanted to do, in addition to continuing to collect optimal amounts on the revenue that is coming in, is to identify different partnerships in the industry that we can bring to our clients to help improve patient volume, to help find ways to improve business and to bring you more value. And that's what we're doing today. So we're kicking off this program with our friends at the TeleDentists. We have Leah Sigler and Dr. Maria Kunstatter with us today. They're going to take you through their program and how it can help your practice improve revenues and increase patient volume. So with that, I'm going to send it over to our friends from the TeleDentists.
Thank you so much, Carrie. Appreciate you letting us come on board today to talk about one of our favorite subjects. I'm going to go ahead and share our screen so we can show you the beautiful PowerPoint we put together for the presentation today. And away we go.
And thank you for using innovation and technology to, take care of your customers and give your customers the benefits of all that.
Absolutely.
So we are going to talk about implementing teledentistry in your dental practice and the benefits that you can acquire from doing so.
It's a guideline for 2025 and beyond. For those who haven't started yet, it is your time.
So I'm Dr. Maria Kunstatter. I am a dentist. I am the CEO and co-founder of the TeleDentists. I'm a wife, mother, and grandmother. But today I'm going to talk about my two favorite subjects, teledentistry and my grandchildren, and I will spare you the grandchildren discussion unless you ask at the end of the Q&A. But anyway, we basically have been doing teledentistry since 2014, way before COVID. And we were the first teledental communication consultation company ever developed. So we started the industry back in 2014. So we're very delighted to present it to you today.
I hate following that slide because mine's a lot shorter, but my name is Leah Sigler. I am a dental hygienist, a wife and a mother, and I've been dental hygienist for about 10 plus years now, and in the practice with Dr. Kunstatter for a lot longer than that. I'm the president of the TeleDentist and the founder of the Virtual Tooth Fairy. We're not talking about the Tooth Fairy today, but for those who are interested, especially pediatric offices, let me know, and away we go. So, what have you done to add new patients and increase your revenue in your dental office? As Carrie mentioned, we've seen some serious issues in the dental industry. And if you are one of the many offices that are scrambling to try to do these two things, adding patients and increasing revenue, we are here today to present a new solution for you and your office.
Again, the Health Policy Institute with the ADA put out this questionnaire about what people are doing to improve and maintain the sustainability of your dental practice. And downsizing the team is not a problem right now because it's really hard to get staff. But have you, changed your dental material supplier, raised fees? Again, raising fees means you're going to get more per crown, but are you going to get less people coming in for those crowns? That's a risk benefit ratio. Have you had to borrow money from the bank? Have you considered joining a DSO? What have you done to maintain the sustainability of your dental practice?
I think the quote from the dental hygiene side was about 30% of hygienists quit during and post COVID. So downsizing a dental team, like you mentioned, is not an issue. The issue that results in it is not having a team.
So worrying about staffing is huge right
yes,
now. So that's
big time.
So which of your factors prevented your practice from having a full schedule? I mean, if we don't have a full schedule, we are always worried about what to do when that chair sits empty. Are you having trouble filling vacant staff positions? Because again, without being fully staffed, you can't fully function. Not enough patients making appointments. No-show and cancellations have dramatically increased. Whew. 85%, and patient no-shows that are over 24 hours prior, up to 43%. So when you're implementing correctly, teledentistry can actually help you reduce those percentages of cancellations and fill those holes of these common pain points of every dental practice.
Mhm.
Again, can your practice survive at 83% full schedule? Very few. Is your overhead reduced 80 to 83% of what you owe? No. And we're going to be here today to talk about how you can increase that 83% of your scheduling.
And a big thank you again to Elevate for inviting us to show you one amazing technique that can change all of that for you. So, how does teledentistry fill your schedule? We're going to talk about today the different modalities of teledentistry. We're going to talk about how your office can be open 24/7, 365 with virtual care. And we're going to discuss how not only it fills your schedule with those patients, but it fills your schedule with educated patients, patients that are ready to get their treatment completed and case acceptances, and how it can also help your office team be able to do some work from home and virtually as well.
So I love to talk about the history of teledentistry because those that aren't doing teledentistry, well, I don't know, it's just so newfangled. Well, it's not. In fact, I like to say when the first telephone was invented in 1849, and for your information, it was not Alexander Graham Bell, it was an Italian. Google that while we're talking. I said during that, if the one picked up one end and another picked up the other end, and one said my tooth is bothering me, and the other one said go chew on a stick or whatever they did in 1849, that was teledentistry. It's using telecommunication technology for dental care. And here's a timeline of teledentistry. I also love to say if you can't read this easily, you need to have a teleoptometry visit, and they actually can do refractions through teleoptometry and get you new glasses so you can read our timeline. But the timeline again starts in 1849 with the first telephone, but actually in 1959, the University of Nebraska established the first two-way television setup to transmit to medical students across campus, and 5 years later linked that to a state hospital to perform video consultations for telehealth. So that's way back then in Go, Nebraska. But again, the most prominent thing people that know much about teledentistry know was in 2010 when the Pacific Center for Special Care developed virtual care home project, which would send would send a hygienist and a team out and have with a camera, a nomad, and a computer. And then the dentist would stay in their office and be looking at x-rays sent over and photos sent over, and say, this patient needs to come in, this patient's fine, go ahead and do the hygiene, do the fluoride varnish. And that would actually obviously increase their patients that are brought into the practice. It was all the way to 2018 that the ADA approved the codes so that we can actually bill for teledental procedures, and the story continues on.
So the future of teledentistry is here and now. Obviously, COVID put us on the map because telehealth use was up by 53%. But did you know telemedicine is the fastest growing place of care? And it's teledentistry is a portion of that. So large payers are now contracting for teledentistry. In fact, we are the teledentist for Aetna, Anthem, HR&I Dental, Centene's Dental Division. I mean, you name it. We work with large payers across the country. Cigna came to us 3 weeks after COVID hit, and everybody was desperately looking for a teledental company. And now they're even reimbursing for these teledental codes. So we're going to discuss the codes. Let me move this little bit out of the way. There you go. And teledentistry is being part of the healthcare profession, including the teledental profession. Gotta find my button here. There you go.
Again, teledental homes were the first, most common awareness of teledentistry, and that's asynchronous method of using teledentistry. And we're going to talk about that some more as we go along. But it basically was a perfect storm for teledentistry. You all may be old enough to remember DeMonte Driver, a young gentleman. He's 12 years old.
Kid.
He was a child that actually was taken to an emergency room 3 times with for an emergency headache. He actually had an abscessed tooth, which was never diagnosed or treated until his second brain surgery, where they then took out the infected tooth, and this young child died of an abscessed tooth in 2007.
And I want to enforce that it's not an age or a socioeconomic, because look at the NFL player that passed away not too long ago. So people are still going to the emergency rooms and urgent care centers. In fact, they spend on average, the latest study said nearly 2 billion healthcare dollars were spent. Oh, sorry, 3 billion healthcare dollars were spent in emergency departments and on toothache codes in 1 year. Now, unfortunately, that's paid for by healthcare insurance versus dental insurance. So imagine triaging that 3 billion back into the dental industry. That is what we're here to do today.
Yes, and again, studies show over and over again that by integrating oral health with healthcare, we can reduce healthcare costs by up to 17%. So again, the Surgeon General and the American Academy of Family Practitioners and the Academy of Pediatrics all stress that oral health must be part of primary care. And in fact, the World Health Organization, hold on to your seats, because they have mandated that oral health be part of the universal health care plan by 2030. So
Who?
there, yeah, the WHO, yes. And there will not be enough dentists at all to be able to fulfill that requirement. But with teledentistry, we can actually achieve access to oral health care globally with teledentistry.
And now with telehealth technology, we are able to white label that technology for dental use, which is what we did at the TeleDentist at Dr. K's concept. No, wrong button. There we go. So what is teledentistry? Well, it is the merging of telehealth and dentistry. So what I like to say when I'm giving my elevator speech about the teledentists is, if you've had a telehealth experience, which majority of us did, especially during COVID, it's that exact same thing, but you're connected to a dentist for oral health needs. So it is the perfect combination, and this graph shows it, of telehealth, technology, and dentistry. I keep pushing the wrong button. Oh. All right, we're gonna try again. Sorry. There we go. Yeah, so see, I'm supposed to be the technology person. There we go. There you go.
And the telemedicine market's growing and has been growing. It's not just a COVID blip. But it is projected to grow at a 20% growth rate and growing all the way to, $143 billion by 2025.
And teledentistry is a market within that. In fact, in a couple of years from now, it's projected to be $2.6 billion by 2027, which, as Dr. K said, it is a growth rate of 17%. Is your office growing at that rate?
Are your investments growing at that rate? Don't you think it's time to invest in yourself and spend some of your money on bringing this technology forward into your practice?
$3 billion. Let's talk about how and where we can put that back into the dental office. So there's a couple of different modalities. We're going to discuss the different ways in which you can conduct teledentistry, but in essence, we are trying to reiterate that teledentistry includes patient care and education. There are 3 pillars that the teledentist stands on, and that's educate, because the patient's presenting with a condition. You are the oral health care professional. You can educate them on that concern. Palliate, which is being able to be prescribed when indicated different medications, and then of course triage. And triaging them back to your dental office is what we're going to teach you how to do today.
And I love to talk about the palliate part, because people don't know what they don't know, but dentists know down that aisle in dental care, there's temporary filling material, because many times the patient says, this broke my tooth, it doesn't hurt, but it's hurting my tongue. And they always talk with their out the side of their mouth because it hurts for them to move their tongue. And dentists and hygienists and dental staff know, go get that temporary filling material, plug up that chipped off part, smooth it out, and your tongue's going to feel better instantly. So it is basically getting the right specialist to the patient for the right needs at the right time.
So real quick, we're going to go over each of these, so don't feel rushed. But we have our synchronous consultations, which is live, immediate access. We have our asynchronous, which many of you have heard of as store and forward. There's remote patient monitoring and mobile health as well. All of these treatments, some of the ones to consider, general considerations, there we go, is that patients who do receive these services through telemedicine, you must properly document your interactions with patients using telehealth, and you should also provide them with referral protocols. So dentists who deliver these services must establish protocols, which we already have in place for you, and we will teach you exactly how to do them appropriately, necessarily, and legally so that you are compliant with all the different rules and regulations of dentistry and telemedicine. So let's break it down. Synchronous, that is about 99.9% of what the teledentist does, because our true core belief is that if a patient wants and needs to talk to a professional, they want to do it now. They don't want to wait for a call back. They don't want to wait for you to write up some notes and send it to you. They need to speak to somebody now. So what the teledentist does is live synchronous video consultations. It's a two-way interaction with a caregiver or provider and a patient. And we use a compliant and secure telehealth platform to do this. And consultations are done either through phone, any smart device. We have patients, sorry, providers that are sitting at their home clicking on their computers. We also have providers that use on their cell phone when they're traveling. So immediate consultation to connect with your patients.
And it is a HIPAA compliant platform. And
Correct.
I've taken calls in restaurants. No, I don't sit at the table with my friends and guests and do the consultation. But when I get a call, I'll look around and find an empty booth I can go to. Or if there's not an empty booth to go to, I can go outside and do a video consultation with a patient anywhere me and my phone happen to be going.
Absolutely. We even have dentists who are traveling or living abroad, and they're able to take calls still for their patients back at home because they were connected through our platform. There's asynchronous. Now, this is store and forward. That's where there's a transmission of records like x-rays or charting or proposed treatment that's sent through our platform through the secure communication, where the provider then evaluates it and then goes back and renders the service. So explaining, for example, this person on the screen is looking at x-rays and the question could be, do I really need to get this root canal retreated, or does tooth number 14 actually need endo? This is a great way for you to be able to provide those services while not immediately connecting. We do offer these services as well on our platform. And we also want to focus on the fact that clear aligner companies do teledentistry, while some did not do correctly and claim to be teledentistry companies like Smile Direct and Bite. Unfortunately, they took the flagship on the word teledentistry, and we are still cleaning off the mud from our shoes on those two companies because look what happened there, because they didn't do it correctly.
And by the way, when your patient takes a picture and sends it to your cell phone, that is not HIPAA compliant. Again, what Leah talked about previously is having your protocol established. If you have the teledentist app on your cell phone and they can send you a photo through the teledentist app, that is HIPAA compliant. And we need to remember safety, patient safety and protection and privacy.
Especially with all these data breaches, my goodness. Obviously, as a hygienist, I love remote patient monitoring and mobile health, but this is a fantastic way for people that are doing outreach programs like in schools or in SNF communities to leave teledentistry at the location and be able to take care of those patients even after they've performed procedures. And remote patient monitoring is a fantastic way to integrate AI, doing AI scanning and evaluating of teeth, and then connecting with the teledentist to review those results. It's a fantastic way for public health practitioners to be able to do that and support their patients as well as themselves.
So you are all teledentists if in your office you're using technology for dental care. That's what teledentistry is, using telecommunication technology for dental care. So you make phone calls, right? You're texting your patients. You attend webinars. You do use emails. You use reminder emails and texts. That is all a form of teledentistry. So you're all teledentists even before starting with our program. In fact, I love to say anybody attending this meeting or watching this video, this webinar is a teledentist because they're using telecommunication technology to learn about oral health.
There we go.
So there's a lot of benefits for teledentistry, and we love to talk about increasing revenue, opening up chair time that, the patient doesn't need to be there. And when you go into your office, or not tomorrow, Saturday for you, most people, but when you go into your office day one after watching this video, you can assess each visit that comes in. Did I really need to see this patient? Did this patient really need to drive in, take time off from work to come see me? If not, they could be a virtual consultation, and you could open up that chair for more productive patient care. Again, new patient appointments, new patients. You can provide a consultation to engage them in your practice before they even come in, and they'll be there for sure for their new patient visit. And open up all that chair time for valuable, crown preps, implants, etc., where you can be doing the consultations when you're sitting at home or sitting at your desk in your office.
Think about all that plastic you've wasted by having somebody come in just to write a prescription. You've got the chair cover, you've got the air water syringe, all of that. I mean, not only is it great for your office, but it's great for the globe, for the planet. What do we're the green teledentistry. Teledentistry is green. Next slide. There you go. So go ahead.
2025 dental offices need to have the key trends currently now are integrating teledentistry, doing AI integration, digital smile designs, growing emphasis on cosmetics. Obviously, staffing shortages is a huge problem. Therefore, you don't have to have as many people running around when you're managing a lot of these patients with virtual care. And then rising costs. That's an ever-present problem. Again, go back to that 83%. Are they productivity? Is any of your overhead reduced down 83%? No, it continues to grow. So the time to adapt your business model is now, and marketing strategies are important.
So in order to adapt to these trends, this is going to be a hard one, but you need to embrace technology. It's not hard. I'm sorry, I had to joke on everybody, but technology is nothing new to us. We use it all the time. And now we're able to embrace this new technology to better serve our patients with virtual care. It also improves patient experience. The patient that's in pain that can immediately connect and get relief, not only physical relief with the prescription maybe, but the emotional relief, you're going to get better net promoter scores. And it differentiates your office from the one probably in the same building, because you have new offerings at convenience. And with the digital use, you're going to be able to do a lot more digital marketing.
And you can streamline. Okay, so what?
No,
you can streamline your operation. Again, go through your daily schedule next time you're in the office and say, I didn't need to see that patient. That patient, that half hour share time could be used. I could do that patient for 5 minutes on a virtual call. Just assess what you're really doing in real time and assess what you could do virtually, and you're going to actually increase your revenues because you're opening up more chair time for valuable patient visits.
In fact, we even call it the virtual chair because you'll be reducing the patients that are filling in that chair time, but being able to plug in virtual consultations without the increased use of the PPE.
So what benefits have people that are using teledentistry found? 63% reduced number of inpatient visits. Again, opening up, can you imagine opening up that kind of chair time, but not reducing your costs, increasing your costs, because those that are sitting in the chair are revenue generating chair time. Again, 57% increased access and quality of care, and 38% reduced patient anxiety. I like to say people are afraid of two things about going into a dental office: how much it's going to cost and how much it's going to hurt. Telehealth visits don't hurt. and you establish a relationship with that patient before they come in, and they understand what they need to come in, and their anxiety is brought down a lot. We do see a lot of phobics. Imagine that, because they're not afraid to talk to us on teledentistry, and we again educate them, palliate them, and get them into a dental office when they need it. 31% lower costs for patients, and patients are more receptive to care because they're educated.
Yep.
So better care for marginal communities, absolutely. That
Yep.
mobile health. And what type of teledentistry is being used? 53% use synchronous and 63% use asynchronous. So a combination of both. Obviously some use a combination of both.
Yeah. Why not? It's all about how patients feel. So how do patients feel about teledentistry? Well, they want it and they want it now. In fact, Dentavox came out with a study that said 78% of your patients would be likely to use it if they knew that their provider actually offered it. I mean, that right there, 78% of people in your office want to be able to use teledentistry. You should be offering what they want. I mean, that's just a plain and simple, straightforward fact. And why would they want to use it? Well, it makes it, or what would motivate, pardon me, patients to use it? Availability, right there. The ease of an appointment, and also no access to another dentist. I can't tell you how many times a day the teledentist nationwide company gets people pinging through saying, I have this appointment next week, but I can't get a hold of my doctor and I'm in pain. It's Friday, your office is closed. What are you going to do to help supplement those patients and still provide them access of care? Button. There we go. So, what are the best use cases according to your patients? Um, Health promotion and education and prevention. Again, the talk about the decreased spending for your patients. Prevention is a fantastic way to help them, especially as a dental hygienist. I can go online and give oral hygiene instructions and still be able to go see my scaling and root planing full mouth patient. It is a fantastic way to help deliver the education that the patient needs. Diagnosis and dental disease risk assessment tests. We have a fantastic risk assessment quiz that your patients could take and then review that with them on teledentistry. And of course, preventative procedures, making sure that they are not in need of coming in. It's all preventative instead. Who would benefit from teledentistry? Working people. That's the highest group. Your office is open what, Monday through Thursday, 9 to 5? Are people supposed to just take off time to come see you? Obviously, yes, they do. But imagine being available outside those hours and the convenience and the ease for patients. Children, kids who are in school. You go ahead. I know you love the story.
I know I love to talk about there's $45 billion in productivity lost every year for dental emergencies and dental appointments. So what you can do with teledentistry as mom, or a child's got a toothache at school, the school calls the parent. The parent can call you, do teledentistry consult with you. You can prescribe an antibiotic for the child on the way home. Then mom can pick up the child, pick up the prescription, and get home and not have to take the whole day off to make sure the child gets care. And then you can schedule when that child's been on antibiotics and not as hot and bothered about the infection to be seen in your office.
Same with people with disabilities. A local office here in Kansas City works with a group of people with disabilities, and they're able to remote in and show brushing instructions to these folks. And it's so much easier than transferring from wheelchair to chair just to say, oh, yes, you have an infection, and here's an antibiotic, and come back when it's gone. I mean, it's just such a convenience factor. And if you don't believe it, listen to some of our patients. These are actual quotes from some of our teledental patients about how easy and quick it was, and it was way better than waiting for that dental appointment. That right there, all of these folks are able to connect. It was real. It was great. It was quick. She got her prescription in 30 minutes. This is not a picture of the mom, but we actually had a mom contact us at like 3 a.m. and she had 2 children with disabilities, and she had such a bad toothache. She was considering waking them up and taking them to the ED for her toothache. Instead, she found us, and she was able to get palliated while the kids slept and then go get her prescription in the morning. And she would definitely use this service again because it's available. So repeat customers coming back through. And on top of it all, word of mouth. This patient said, I've already recommended this service to several people. It was amazing. So the freest way to get more patients is word of mouth. And can you imagine that patient is like, oh, did you know my dentist starts offering teledental consultations? I can get a hold of her on the weekends if I need to. That right there is going to be a reason for that person to switch offices to come and see you because you're providing a service that they need.
And immediately don't start thinking, none of us went, even I didn't go to dental school because I wanted to be on call 24/7, 365. But that's what our team does for you. When you want off hours, our team can manage your patients for you and get them back into your office at a time that you can see them. So you are covering your patients as is required by ethical responsibility. You're covering your patients with access to care 24/7, 365 by working with us.
Absolutely.
So what are the reasons you aren't using teledentistry right now in your practice? Not you.
You've probably forgotten all the reasons not to by now, for sure.
Cost is low, but one of them, and thanks to Elevate, we are working with them to give all of their customers a 10% off of the cost and 25% off, or $25 off of your implementation fee. So your provider is taking care of their customers by offering a reduced cost to get you going on this program. Technology shouldn't be a barrier anymore, because if you have a mobile phone or mobile device, you can do teledentistry on your mobile phone or your mobile device, and almost all your patients have. In fact, it said 97% of people globally have access to cellular service. Payments are, again, thanks to Elevate, your payments are going to be reduced with us. And no need, I think we're demonstrating right now that there is a huge need for teledentistry.
Yeah. And why did you begin? Because obviously this presentation is amazing, but besides us, it's added convenience for your patients. And yes, COVID is still around. People are still coming into the dental offices masked or not coming in at all because they're scared. Accessibility. We had a patient come in through the teledentist who would have had to drive 90 minutes from her rural town in Montana all the way to a dental office just to be told she needed an antibiotic and to come back when that infection's gotten lower. So 180-minute drive just to receive antibiotics versus a 5-minute consultation with the teledentist from home. And of course, specialty consultations. If you do see somebody that could potentially need a root canal or even oral surgery, you can refer within our teledental specialty consultations. This is a new generation of patients. They want access to care immediately. As a millennial, I can speak for majority of us that this is always with me, and this is what's going to get me to book an appointment. If you're not on this, then I'm not booking with you. And we do have excuse right here. So go ahead.
Again, and this is a great way, new patient generation, two ways of looking at that, but you will get new patients from doing teledentistry as well.
Absolutely.
And we did a nationwide survey to see what patients' access to your offices are. And again, once again, the average dental office open 40 hours a week is only 24% of the time during a week. So 76% of the time, what are your patients going to do? And our survey is we're going to talk about that in a minute, but unfortunately, you've heard over and over again the practice management things. People who get a voicemail don't even leave a message. They go to the next website and say, who can I talk to? When can I talk to somebody?
Right
I don't
now.
want to leave a message on a cell phone. Don't leave your customers hanging. Again, sadly, we have too many people come to us that have a dentist but can't get a hold of them.
So our survey, does this sound like it might be your office? When we called nationwide again, it was leave a message, 35%. No answer, even 5% just ring. Nobody answered. Or 15% was an answering service who had no idea how to help because they weren't dental people. You could book online, but there was no chat response. So many dental offices on their voicemail would say, if this is a dental emergency, go to the ER. You are contributing to that 3 billion healthcare dollars spent in an ER by saying something like that. And that is a unfortunate part of the dental industry right now.
Again, statistically, it shows 95% of people that end up in an emergency room with a tooth concern are not a medical emergency. 95% of that $3 billion don't need to be there. They need to be in your office.
I'll take a slice of that.
Well, let's figure out, we're going to discuss here how to get those patients into your office. So 5% had a real person actually answer the call. And there, again, nothing on the website about emergencies 5% of the time, nothing on the website at all. 15% gave the doctor's phone number and one mailbox was full. So you give somebody a phone number and the mailbox is full, it doesn't really help now, does it? And then 5% said text back and will return your call during regular business hours. They've gone to your website, they're looking for help, and will call you back during regular business hours. In fact, my favorite response is this: what kind of message your patients are getting? My favorite response we got was literally, quote, "When you contact us for dental emergency, please do so during our normal business hours."
Because that's when dental emergencies happen, is during business hours.
That's on somebody's answering machine in the United States. Again, that's my sad laugh. A 24-hour dentist can call you if you're a patient of record. Let's talk about new patients. If you're a patient of record, leave a voicemail. It rang 10 times, the voice, and there still was no answer, so that you couldn't even leave a voicemail if you wanted to. Leave a message and we'll get back to you during regular business hours. Or actually, the emergency dentist was leave a message. I mean, they're advertised as emergency dentist. Their website said emergency dentist and said leave a message. But the biggest issue too is it always says established patients only. That was a universal. Only established patients could have access to their emergency consults if they were available, or if they had a text or a phone number. How many people in the United States don't have a dentist? 50% of our population does not have a dentist. Of your patients, practically, I think it's 30% of them only go regularly. So there's 70% that don't really have a regular chart in your office. So there's a huge number of people that are searching off hours all these websites, and we spend thousands of dollars to develop these websites that should be a portal into your practice. And here's how you're going to do it. Instead of say, call us back during regular business hours, you could say, talk to a dentist now. Click here on your website. Straight up, straight front. Isn't whether you're a patient of record or a non-patient of record. Clicking here could go to the teledentist who would be on call for you, and then they would be dropped back into your office for the appointment when they need hands-on care. So it is vital that as dentists that we respond to our patients. It's required by our ethical code to be to our patients of record. But what about that 83%? What about those patients that you have that hole in the schedule and they're not patients of record? We need to help them too. So
are you still using that phone? Are you using the rotary or operator? No, you've grown, you've matured, you've got the new fancy Android or iPhone. Now do the same with your dental practice.
And I remember my first CEREC crown. That's about what it looked like when I started, and that's pretty much what it looked like in the mouth. Still ugly, learning curve for everything. And by the time I used it a few times, they were starting to look pretty good. Teledentistry is the same thing. There's a learning curve for everything. Still using a slow speed handpiece. My mentor when I was in dental school said that when high speed handpieces came out, they were going to ruin the dentistry as it was known, because it would destroy tooth structure and ruin the whole dental profession. Did that happen?
Can you imagine doing dentistry without the high speed?
Right.
And in a couple years, we're going to say, can you imagine doing dentistry without teledentistry?
Right.
So that's our fun little tidbit there.
And again, we need to be aware that there are, tooth decay can be reversed now. We have technology, we have innovations. The whole dental profession is changing. So we adapt and grow and embrace technology and innovation, or it's going to be like the Blockbuster stores. I think there's one left in Alaska. You don't want to be a dental office like a Blockbuster store where you didn't keep up.
The kids don't even know what commercials are, let alone Blockbuster. Oops, I'm sorry. Okay, so now let's talk about how to navigate implementing teledentistry or virtual care into your practice. We had to do a nautical theme there. So obviously, it's all about the doctor-patient interaction. You need to make sure, and again, all of this is included in the teledentist package that we give you. If you choose to implement teledentistry, you need to remember that you have to properly document your event. The notes in your EagleSoft and your Dentrix, Open Dental, whatever you use, are your legal documentation. That's the same for teledentistry. Our platform has SOAP note format with templates that you can use, all saved in a secure, save and store in a secure chart on the cloud. You're going to provide the patient with a summary of services. In fact, there's a great way to download the event as a PDF and upload it into your EMR. That way you have a record as well for billable purposes. And of course, providing that necessary referral back to your office on the day that is, needing to be filled when necessary.
And how many of us haven't had that patient send a photo or call you while your kid on Saturday at soccer practice, you're on the phone with your patient? That's not billable when you're on the phone with patient. If you have the teledentist installed and you use that system, it's billable.
And it pays off. When just 7% of in-offices appointments were converted to virtual, they were able to reduce the annual cost of treating patients in the office by 70%. If you don't love that, your accountant will, and your bank account will too. So an average teledental consultation, we say we offer 15 minutes, but truthfully, our average is about 7 minutes. And if you go to our website right now and a patient pays for a consultation from our website, it's $64. 7 minutes for $64. You do the math. That's a pretty good reimbursement rate. And patients love it. Again, we have like an 85% or 85 net promoter score, which is amazing. And this is just the tip of the iceberg. When are you going to start getting and receiving the payoff? Marketing is key. Again, if patients don't know you offer it, they're not going to use it. So as part of the package that you'll get from the teledentist, we give you an entire marketing kit. It's going to create awareness for this new service. So you're going to send out emails saying, now offering virtual care, open 24/7, repeat, repeat, repeat. You have to hear it 7 times. How many times does the patient have to?
17 times.
There you go, 17 times. And
Before
they
some
still
people act. Yep.
Yesterday, I still don't know how to floss. Right. Anyways, you're going to place an ad on your website and all social media, that blue button, however you choose to put it, whatever color, we don't care. Virtual visits now. Click and immediately connect. We want to see you succeed. So we give you all our SEO words for your website guy to plug in or gal to plug in. It's all the keywords that are hitting, like dentist online, emergency dentist, dentist near me, all the SEO words we provide for you.
And again, what I love to show, and Dr. Laskin gave me permission to do this, you guys might know Dr. Laskin, is when people are searching for a specific dentist, they search for Dr. Laskin, they immediately go and say, the first question is, where is this office located? And the second question on Google is, do they offer telehealth services? They don't say, are they doing implants? Are they doing cosmetics? None of those questions are asked. The second question asked is, are they offering telehealth services? So again, I just said that, so they don't ask cosmetics or anything, but basically, does the doctor offer telehealth services? And this is on Health Grades. And if you haven't gone on to Health Grades and claimed your profile, now you have a reason to do it, because your profile is on Health Grades. Now be the doctor in your community that says, yes, I offer telehealth services. And when people are looking on Health Grades, they'll find you.
It boosts your Google search. We are not getting paid, by the way, for Health Grades, and you don't have to pay either. We should. It'd be awesome. It is free to sign up, and again, it enhances your SEO. So when somebody searches dentist near me, your Health Grade, just like Dr. Laskin's, your Health Grades profile pops up, and it can say yes to teledentistry services.
So we won't go through all the things. We can send you these. We do have a brochure with all this information, but teledentistry services are limitless of what they can do, except for drill and extract. So we basically, when patients enter, they check a HIPAA compliant agreement and a telehealth agreement, which just says we're not going to reach across and extract that tooth, but we are going to get you, palliated, educated, and triaged to care as needed. We like to call ourselves dentists' best friends, our big company, because we put people in your office. Again, if you're a teledentist with our program and in your office, you'll be the first on the list in your area to get one of our patients. If we get one from our national service, we're the teledentists for WebMD, so we get a lot of patients from all over, and you'll be the first practice on our list for putting that patient that comes to us in. So we're your best friends, and we can continue to be your best friends by helping you offer this service to your patients.
And we also help you train your front desk team because it is super important that they get the wording right on how to invite patients. So when they're answering the voicemails from Monday from the weekend, or if they're answering the call and the patient's saying, I have a toothache, and they're looking at your schedule like, oh, fingers crossed, this schedule's too booked. We can see you in a couple of days. That patient's going to leave. So it's all about inviting the patient to connect virtually. And we also teach them the reimbursement codes and methods. It is up to your office to negotiate these fees, but the average reimbursement rate for a teledental consultation right now on a PPO plan is $52. So again, we're in the Kansas City metro area. This is a nationwide concept. The prices do fluctuate, and we do again teach your team how to bill and reimburse. One of my favorite dental offices that uses our program actually makes the patient pay their deductible, if you will, so like $50, and they will file for reimbursement, but they'll take that patient's $50 and use it towards treatment. So they apply it to their account. That kind of gives the patient more reason to start work with that dentist because they're like, oh, I already have $50 down. I can go get that crown worked on now and use that $50 towards your treatment. So again, we give you a lot of techniques and we want to see you succeed. We also want to remind you about your malpractice insurance. Now, we did help create the very first teledental malpractice insurance ever. So our dentists are covered. You check with the one that you already have and ask your carrier if they cover teledentistry services. A lot do now because a lot more dentists are using them. And then if they're like, no, we don't offer teledentistry coverage, ask them what happens when you pick up the phone and talk to a dentist or a patient. That's essentially using teledentistry. So your carrier needs to start also accepting this new cool technology and covering you as well.
So it's just like when you sit down by a patient the first time you see him in the office. You don't sit down with the pokey things, as the patients like to call them, with the mirror and the probe in your hand. You sit down and start talking to the patient. You look at them eye to eye, and you discuss their history. Now, again, our system has a brief medical history, brief dental history, chief complaints.
And I want to make sure you understand that when the patient fills all that out, that makes them a patient of record within the teledentist platform. So this is establishing care with that patient.
Yep. And again, and that's setting up your protocols, and our system has a protocol for having their medical, their medication they're taking, the same things, the information you take when they sit down or come into your office and sit down. So through virtual care, we call it a differential diagnosis because no, you don't have an x-ray, but you can in dentistry for a while, the signs, symptoms, and what is the patient's telling you basically is what the patient's experiencing. So you can do a medication e-prescription from our platform if indicated, of any kind, except we don't do narcotics from our platform, but that again could be an option for you. And then you can have your staff pick it up and say, let's get you in for a visit on this day and this time. And then you make notes in the chart, and then you've done a full doctor-patient consultation.
It's obviously we keep going back to urgent care. It is the majority of patients that use our services are having an acute dental crisis, and this is a very effective way for triaging patients and helping promote the chair time or premium time.
So this is our chart, which is really, again, look at the demographics. It's the 30 to 40-year-olds that are the ones that just want it fixed now. They're millennials. They don't want to wait. They're the ones that call us, but chief reason for calling: infection, broken tooth, toothache, gums bleeding, wisdom teeth is a big one. And then we have a 4.9 out of 5-star rating on Google. So it's a very effective tool.
So everyone wants to know, what can you actually talk about? A lot of things, and we're running out of time. So sorry if we're going to be bouncing through these, but you'll get this slideshow again. Assessment for triage. You can discuss all of this through teledentistry, and we're going to go through a couple examples real quick, and then I promise we will wrap up on time for those who need to get back to their patients. I just want to linger on this screen for a minute, but this is going to be Dr. K's pedestal.
I was an innovator with Invisalign in 2000, 2001. If I had teledentistry, I would have done far more than the elite provider status, because you can get the aligner seated and send them off and never have to see that patient again until they come back to have their attachments removed. You can do all the assessment from home with clear aligner therapy.
Have them check in every 6 weeks, see if it fits. Are you being compliant? If not, bounce back. And you can also, you're very close. You can see her teeth. If she's got tartar or calculus starting to build up, when was the last time you had your teeth clean? All of these things that certain big companies were not doing.
Again, does this patient need to come in? You have her physical history. She's a diabetic and she's got this white stuff on her tongue, and you look at it and go, oh, you have Candida. Let's get her a prescription.
It's not a 7-minute consultation. I'll tell you that. It's a fast one.
And again, we can do functional appliance monitoring. Is it fitting? Is it seating? Are they opening it? Are they compliant?
And kids with parents would love to not have to come in. As a dental hygienist, I don't want to see that in my chair.
Mhm.
That you don't need to come in right now. Let's wait till that. And you can get some
Antivirals.
antiviral cream medications sent in through the teledentist.
Does this patient need to come in? Or this could be from a nursing home or from a patient at home. They take out the denture finally after Lord knows how long. And a lot of times the staff doesn't know to take dentures in and out. And they see this red, horrible inflammation and they think it's cancer. So they're going to rush them to the emergency room or call the teledentist in your office and you go, let's leave the denture out for 3 days and look at them again.
Mm-hmm. Pediatric visits are fun. Again, that virtual tooth fairy is available as well. It's just a great way for kids to be able to talk to a dentist and not have the white coat phobia. And it's also a great way for parents to have a little reinforcement and education. So many times we get parents coming through asking, oh my gosh, this tooth is loose. Yes, it's supposed to be. So we can discuss eruption sequence with those patients and parents and have them improve their oral health with the kids. A lot of kids that are going off to college have these gorgeous straightened teeth, and all of a sudden wisdom teeth are coming through. So now you've got this mass growing pain, and we can help people get triaged to the appropriate specialists.
And another good point to send the teledentist with your kids that are going off to college. The
Yes.
parents just spent $7,000 to get their teeth straightened out, and then they send them off to college unsupervised dentally. But if they're in your practice, you can go with them, and
Mm-hmm.
you can help them through that rather than visit the emergency room. Again, your staff will love this because they can do treatment planning and financial arrangements from home. They can take a virtual hybrid day and work from home and contact all the people, and they can do a three-way call. You know, how many times have you heard, I'll go home and talk to this about this with my spouse? No longer is that necessary. They can bring both spouses in from wherever they are on a three-way call, go over it all and get approval.
Mm-hmm.
So my favorite is talking about scheduling. You know, that 15 minutes before your morning huddle, your staff will come to you and say, I've scheduled 4 patients that called in last night and not sure whether they need to come in. So you sit down at your computer and talk to those 4 people on the virtual call where your staff's getting ready, and then go to the huddle and say, I put this person in here, here, and here, or nobody that was on that call this morning needed to come in.
Yep.
So you triage the emergencies to the appropriate time in the schedule and give them palliative recommendations in the meantime. Also, right before lunch, when you're done, the staff is cleaning up before lunch, you can have 15 minutes before lunch and 15 minutes before you leave at the end of the day. That is all it takes to see about 15 patients virtually, and keep those patients out of your chair, out of using all your chair time, your staff time, and your PPEs.
We want you after this to go back to your schedule, look at today, and pick out at least 3 or 4 patients that could have been done virtually. I bet you're going to find more than that. And it's really important to have a team member. You have your OSHA representative, you have your HIPAA representative. Now you're going to have a virtual representative, a team member who is going to be assigned to selecting patients and helping you convert more to virtual. So doing pre-screening, financial arrangements, triaging emergency, et cetera, et cetera. You're going to have if it's not you as the dentist, it's going to be a primary person who's going to be delegated to be able to help you convert more patients to virtual care.
So it's easy to get started. You wouldn't be on this call if you didn't have your dental license. You have a computer, you have a laptop you can use at home if you decide to take calls. Everybody has a cell phone. So that's all you need to get started. We will train you and your staff on how to do this in your office, customize your site for your office, and you're ready to go.
Mm-hmm. So remember, this is one of our favorite quotes. Companies that most effectively appeal to their consumers in their moment of need are the ones that are going to come out ahead. And thank you, Ms. Johnson, for reminding us the importance of providing what is in demand. And for us, that's teledentistry. So you're ready now. Take off those gloves, kick back, enjoy your sofa, start using teledentistry, and start seeing your bottom line improving, your patients being happier, and you being happier. You don't need a sterile environment, but you sure can smile as nicely as this gentleman here. Or thank you for your time. We cut it almost close enough for some Q&A. Here is all of our contact information. Remember to tell us that you are coming from Elevate so we can give you the appropriate, thank you again, discounts. And get started today, and you will see it. Teledentistry is a game changer for the dental industry and for your office.
Thank you.
Thank you.